How is cerebral palsy normally treated? How can I best help with cerebral palsy? Cerebral palsy is not something that can be cured, as early damage to the human brain cannot be totally reversed. However, there is lots of information, support and treatment options available that may help. It is important to remember most children with CP lead fully independent lives. Each child and family is different, and this is the same as for any child with cerebral palsy and their family. They are a key part of planning care and making decisions about what is important for them. Care is often coordinated by a developmental paediatrician who is working as part of a multidisciplinary team, known as an MDT. That includes different types of therapists and doctors who work together. If many professionals are involved, a key worker might assist with this. The first step in management is usually to identify goals with the child, parents and carers, and offer therapy to support these goals. A physiotherapist will assess a child's activity and what movements they can do. They will advise parents and carers on how to encourage more movement and strength. If appropriate, they may recommend special equipment or orthotics, such as special splints or supportive walkers, to help children develop new skills and support participation. An occupational therapist is often part of the team too, and will also support goals around daily care, positioning, and developing self-care skills and participation. They can advise on adaptive equipment such as bathing equipment and supportive seating if needed. A specialised speech and language therapist can help with speech development difficulties, as well as problems related to feeding and swallowing. As children are growing, monitoring hip and spine development is routine for most children with cerebral palsy. Sometimes children are referred to an orthopaedic surgeon for advice and treatment if problems arise. Medications can be useful for helping relax stiff muscles, reducing pain, and allowing children to move and feel more comfortable. Some children may have one or two particularly stiff muscles which can make activities difficult. Targeted muscle injections of a medicine called botulinum toxin can help relax muscles for a few months. This can help with specific goals when combined with a therapy program, and some children can have longer benefits. Occasionally, more specialised procedures are recommended where increased muscle stiffness is particularly problematic. These can include selective dorsal rhizotomy, intrathecal baclofen, or deep brain stimulation. Coordinated care that is personalised to the individual child is key.